First, an update on China's COVID-19 outbreak. With funeral homes across the country overwhelmed by virus deaths, some people appear to be resorting to other methods for managing the remains of their loved ones. Burning the deceased in the streets. In a video circulating online, a wooden casket is on fire in a rural region of China. It's unknown if the deceased died of COVID-19. In recent weeks, other clips shared to Chinese social media capture people burning other related objects. This video is believed to be from Shanghai and shows paper wreaths and incense papers, known as joss paper, ablaze. Burning them is a common Chinese funeral tradition. They are also used to commemorate the dead. Elsewhere, dozens of tents have been set up in the courtyard of a funeral home in northeastern China. They are being used to store corpses as the funeral home copes with overcrowding. What's more, another facility in northeast China installed at least 4 new cremation furnaces over the weekend, an apparent attempt to match demand for services. In Beijing, crematoriums are working round the clock to meet that surge in demand. A makeshift hospital there is being repurposed into a makeshift crematory, to be complete with 200 cremation furnaces. Here's what one man, believed to be a worker on the site, said in a video.
It's going to be turned into a crematorium. There is a shortage of crematoriums in Beijing. There are not enough furnaces. 200 furnaces will be built here.
The makeshift hospital was previously used to quarantine COVID-19 patients or their close contacts. That's before Beijing rolled back its zero COVID-19 policy last month. In the clip, the man explains that the area where hospital staff lived was being cleaned out and would be instead used by crematory staff and relatives of the deceased. Cremation equipment is already on site. China is still facing a major outbreak across the country. On Monday, a local health department in central China's Henan province said that as of January 6th, about 90% of the province was infected with COVID-19. That means over 88 million people are sickened. That's about the same as the populations of California, Texas, and Florida combined, the 3 most populous U.S. states. It's the first time since China lifted lockdowns that an official health department admitted the outbreak has reached this scale. Likewise, Wu Zunyou, the chief epidemiologist of China's Communist Party, admitted over the weekend that when the number of COVID-19 cases in China reached a certain scale, it becomes possible for new mutant strains to emerge.